Senator Roy Blunt is ranking member of the Senate Appropriations Subcommittee on Health, Labor, and Human Services. He just wrote a letter to the administration demanding answers on the money that was spent and why there's a testing shortage. And he joins me now. Senator, thank you very much. Good to have you here. You just heard the president and what he said about this. Did you get the answers that you're looking for there?
No, we haven't, Martha. Senator Burr, who has the authorizing committee, I have the appropriating committee, is the top two Republicans on each of those committees, sent a letter last week to the Secretary of Health and Human Services. We actually have about $10 billion that weren't in that adding up that you just went through. If you take all five of the bipartisan COVID bills, that's about $32 billion, and then about $46 billion in the bill that the Democrats passed by themselves this year for testing. And the real question is, how was that money spent? How could we have a testing shortage now when at the end of last year we had what appeared to be a whole new series of tests coming on the market? And I think my other question would be, if the federal government thinks they can buy 500 million at-home tests by the end of this month, where are those tests now? You don't have to look very hard to go to a drugstore and find out that they're out of those tests. You'd think if they're available, they'd be on the store shelves right now rather than waiting somewhere for the federal government to buy 500 million of those tests. And again, remember, this is $83 billion have gone into testing, and they've had all of that money for a minimum of 9 months, and suddenly we have a testing shortage. I think one of the questions is, was that money spent for other things? And if it was, how do you justify that if you're the administration and the department?
Yeah, you know, this administration told the American people that they were going to solve COVID, that the prior administration had done a terrible job, and that in this administration, things were going to be very, very different. So I think that, you know, members of Congress and the American people sort of signed on for this tremendous expenditure of U.S. taxpayer dollars to fix what people saw as some of these issues. And I want to put up these numbers again. And I know you say it's 10 billion higher than the number that we have, and you just laid out why. But this is the specifics in terms of the way it was presented at that point with those numbers. 47.8 billion to carry out activities to detect, which would mean to test, diagnose, trace, and monitor SARS-CoV-2 and COVID-19 infections. Then you have the Paycheck Protection Program, 25 billion to research, develop, validate, manufacture, purchase, administer, and expand capacity for COVID-19 tests. Now, what do you think actually happened here? Do you think that over the summer and the fall, when it looked like this thing might have been over, that they just diverted that money to other things?
Well, you know what we're seeing here, and let's just even talk about the $47.8 billion that Democrats all by themselves decided in March that they were going to spend on testing. Where did that money go? Did you decide that if you're the administration, decide, well, we've got a lot of flexibility because of the way that bill was uniquely written so that that money could be spent in more ways than you could normally spend appropriated money? Where did that money go? Did you decide that the crisis is behind us, and so let's spend that money on something else? That's exactly the questions we're asking now. And of course, it's always the problem in preparedness for what might come next, is that once you get around that corner, people can say, well, maybe we don't need that money in stockpiled vaccines, or maybe we don't need that money in an Ebola preparation effort. Let's spend it somewhere else right now because I don't think we're going to need it. And then you find out, well, like with this testing money, that you needed it. You needed to spend it months ago. And what was the worst thing could have happened if those tests were in stores right now and people could get them? And then you combine that with a suggestion that everybody has to have even another test before they think about going to work after they're beyond the window of where COVID should last. You're telling people to do something and then almost guaranteeing they don't have the resources to do what they need to do. And it's not that they don't have the money to have what they need, it's just that they simply don't have what they need because that money hasn't been spent the way we were told it was going to be spent.
Yeah. Before I let you go, sir, and I know that the briefing's underway, we're going to go there in just a minute. But with regard to the billions that we also mentioned that were spent so that schools and universities could stay open and could open safely, all kinds of measures were given and money was given. And now it feels like some of them are kind of pulling back on that promise that that money was exchanged for.
Well, I think that's a good question. I think often this money was dispersed without the guidelines that schools needed or the guidelines that states needed, and now we're seeing what happens when there's not an understanding of what you can use that money for, because when you don't have an understanding, a lot of people think, well, maybe if we just don't spend it now, we can spend it later for something we want to spend it on.
Billions. And it's all U.S. taxpayer money. It's something I think we need to all remember. Senator Blunt, thank you very much.
Thank you,
Very
Martha.
good to see you, sir.